It gives me enormous pleasure to introduce an old friend and someone you all know very well, Richard Brown, who's consultant paediatrician at Cambridge University Hospital, Addenbrooke's, where he deals with patients with epilepsy and also metabolic medicine. And more importantly, in the context of today, he's the chair of Open UK, and he's going to give us an update on Open UK and recent working group activities. So, Richard, it's over to you.
Thank you so much, Finbar. That's absolutely brilliant, and thank you very much for chairing today. I would echo Finbar's earlier thoughts about the importance of joining the BPNA, which has been transformative for me personally in my career. I've loved being a member. I've learned a lot and I've met a lot of wonderful people through the BPNA. So I'd highly recommend it to all of you. Also, just harking back to our the earlier part of the conference today, I just want to thank Emma and the young people who participated in the that last presentation. That was absolutely fantastic. It's brilliant for two reasons. Firstly, in so many ways, it reaffirms the importance of what we're doing. And I'll speak about a few things in a minute that are the kind of major pillars of Open UK and the things that we're trying to get our teeth into. And it's so reassuring to hear from young people that these are important things to them. But also, as always, you set our agenda for the next year. So I've picked up things from that we need to take forward within Open UK for the next year. And I'm so grateful for that insight. And also grateful that we got a chance to see Owen's chin strap beard, which seems to have come on an absolute treat during lockdown. So congratulations, Owen, on the new beard. I have a new arrival in my house as well. So at the moment, I have an 8-week-old puppy sleeping on my feet. And since I don't want to wake the puppy, I can't show the puppy to you, but we'll see what happens before the end of my talk or before the end of today. But that would be a treat indeed. So my mission today is to talk to you about Open UK and update you on the long-term plan. I'm going to start off by talking about Open UK, and I think sort of round off with the long-term plan, just because it fits in so nicely with what we just heard from the young people. So the major active issues that we're looking at the moment are around trying to support routine access to co-located mental health care for children and young people with epilepsy. And this is absolutely crucial. As you know, we've now got this in as best practice within the best practice tariff, but with no new money associated with it. So how are we going to deliver that in the brave new world? And I would commend to you the MICE study. So at the moment, the MICE study has recruited about 250 patients, predominantly through Great Ormond Street, delivering routine co-located mental health care with assessments and interventions that are deliverable by professionals throughout epilepsy teams, as well as mental health professionals, and should give us a template that we can look to for clinical effectiveness and cost effectiveness in the future in terms of delivering routine co-located mental health care. And I'm very fortunate that we're going to be participating in the MICE trial in Cambridge, which is why I gave myself a silver on the comment about being able to deal with worries and anxieties in clinic that the Emma Sparrow set us earlier. Other issues that we're passionate about include contactability, which again was obviously highlighted so eloquently within the young people's presentation, and adherence, which was the subject of Martin Kirkpatrick's talk at the conference last year. And I think both of these tie in with the last pillar that we're really pushing at the moment, which is about the development of tech and online resources to help children and young people with epilepsy. and clearly contactability, adherence to treatment, support for worries and anxieties, all of these can be ameliorated through appropriate tech. And we're looking at the interoperability, the speaking of the same language by apps and databases and national audits and electronic medical records and the commissioners and really everything that uses data, so that we can try to pull together apps that are not just useful in one trust, but for example, across the country. So we're developing that all the time. Now, I'm going to get a bit meta here because obviously Open UK is a quality improvement organisation. That's what we do. And we're a confederation of regional epilepsy networks, which in themselves are quality improvement structures. And within each regional epilepsy network, we have epilepsy teams. And so if we're going to deliver quality improvements, we need, at each of those levels, we need skills and knowledge and understanding of how to deliver quality improvement. And that's really the basis of the EQUIP project that we're going to be talking about very soon. So this is, if you like, a kind of Open UK quality improvement project, the objective of which is to improve quality improvement across the country. We're going to see examples of how teams who've been trained with quality improvement skills have been able to use those to really deliver better epilepsy care and derive so many benefits from that process. And I'll be talking about that after we've heard from them. So I think EQUIP has been something we've been incredibly passionate about this year. As always, you can only do good quality improvement if you've got good data at the basis of it. I'm so excited to see that the Epilepsy 12 National Audit has published its report today, and Twitter is on fire with this news. So we are looking forward to hearing from Colin shortly about what the news is from the Epilepsy 12 report, because it's absolutely crucial that each and every person on this call looks at that data and thinks about what they need to do in terms of improving the quality of care to the children that they serve. On to the long-term plan. So where are we with the long-term plan? Well, pretty much nowhere. So the long-term plan is in hiatus at present. So the truth is that for understandable reasons, that thing that happened recently that we haven't been really focusing very much on, pan something or other, so pandemic planning and planning now for winter pressures, which are causing NHS England some concern, have really put the long-term plan into hiatus. But we've developed a bid. It's been seen by the UK Epilepsy Programme Board, chaired by Helen Cross, which has lots of stakeholders involved. We're aligned with the diabetes bid, so that kind of, chronic disorders in children are joined up in that process. And in what can only be described as a completely fail-safe process, I would say it's oven ready. Because of course nobody has used that expression about a fail-safe proposal in the last year and then gone on to let anybody down. So we have an oven-ready bid for the long-term plan. Now, what we're looking for from the NHS England long-term plan, obviously, is something that will benefit epilepsy services in England. I just need to emphasise that Open UK, as we have properly nailed on in the title, is a national organisation. So it's a UK-wide organisation. So when we bid to the NHS England long-term plan, what we're saying is, right, this is what we think should happen in England, and we have agreed with the network leads from Wales and Scotland and Northern Ireland that basically what is good for the goose is good for the gander. So if we can secure improvements in care and funding from the long-term plan within England, then we can make a case for rolling that out across the UK. Within England, obviously, we're looking for funding. We don't know how much will be available, and we don't know how it will be delivered. We imagine that it may flow through the sort of 7 NHS England segments into the integrated care systems, and from then it would cascade down into our regional epilepsy networks. And what we're asking for really is something akin to what happens in diabetes, with regional networks, with data analysts, with network leads, with national working group leads, and with a kind of clear quality improvement structure in place. So that's the sort of process that we're looking for, but we still have no clear vision from NHS England about how they're going to support the functioning of the clinical networks that they've said they want. So without further ado, I'm going to hand back to Finbar so that we can hear a little bit more about how Epilepsy 12 will underpin our future quality improvement. And I'll be back after the presentations from the EQUIP teams, because I think that it's so important that we see the success of these of this quality improvement process. Thank you. Fairly confident that I appreciate that one shouldn't pause a national conference for 2 seconds, but just give me a second. Come here. I think it's incredibly important at moments like this that we can see a little Papa. So isn't she just unutterably beautiful?
She is. She is.
There you go. So that's a little treat for everyone.
It might just be the contrast, but no, she is beautiful.